Hi, good morning. Insulin resistance, the root cause of metabolic diseases. How to reverse it? Insulin resistance gives way to metabolic diseases that include hypertension, stroke, heart disease, obesity, type 2 diabetes, liver disease, eyes problem, blindness, skin problems, inflammation. Insulin resistance is the body's resistance to insulin when the cell stops responding to the call of insulin to allow more glucose to enter the cell. Insulin resistance is an impaired insulin sensitivity that makes the insulin hormone less effective. As a result, more insulin is needed to persuade muscle cells to take up glucose, but the cells do not respond to insulin. Thus, it is called insulin resistance. When there is an excess glucose in the bloodstream, human body cannot tolerate such an excess amount to stay there. It is a toxic situation. It immediately sends signal to the liver and the cell to store the excess glucose as fat. Insulin is a storage hormone. When there is excess glucose in the bloodstream, insulin stores them in liver and in other cells. When we eat, insulin is released and some foods are converted into energy for immediate use by our body. The excess foods, that is carbohydrates, are converted into glucose, which is stored as glycogen in the liver and as fat in the cells. When we do not eat, insulin is not released to the bloodstream. The more accumulation of fat in our body, the size of our waist and hips widens. The belly size is enlarged. Our body gets either apple-shaped or pear-shaped. However, one does not have to be overweight to have insulin resistance. We can't tell if someone has insulin resistance by looking at him or her. A prevailing theory of how insulin resistance worsens is that when the fat storing threshold in our fat cells exceeded, our body starts storing fat in less ideal places, especially around the organs in our abdomen, such as stomach, liver, kidney, pancreas, and in our abdominal cavity. This is called visceral fats, and when this fat starts increasing, it is a sure sign of insulin resistance. This is visceral fat. However, it can be said for sure if our daily meal contains processed foods, lots of carbohydrates, refined wheat and rice, including pasta, noodles, macaroni, etc., refined sugar, less than 50% of plant-based foods such as leaf, vegetables, salad, fruits. Not enough fat, butter, olive oil, ghee, and protein, beef, poultry, eggs, seeds, and nuts. We are going to be insulin resistant. So, to determine that, we should get our blood works done for hemoglobin A1C, triglycerides, and HDL. Our children's and grandchildren's A1C checked before they become 19 years old. Once we know the A1C numbers, we find whether we are within the range of non-diabetes between 4% and 4.9%, pre-diabetes between 5% and 5.6%, pre-diabetes 5.7% to 6.4%, or full-blown diabetes 6.5% and above. Currently, American Diabetes Association considers a condition of non-diabetes if the person's A1C is equal or less than 5.6%. Since 5.7% does not happen overnight, the analysts argue that from 5.0%, it probably takes about 7 to 10 years to reach 5.7%. Our body tries to keep our blood glucose level within the normal range, 70 mg per deciliter, 200 mg per deciliter, by releasing more insulin until it reaches the threshold. Once the threshold is crossed, we become pre-diabetic or even diabetic. Once we know our A1C number, we need to act immediately. First, change our lifestyle. That includes meal plan, 50% from plant-based food such as leafy vegetables, salad, and fruits, 30% or less than 30% from carbohydrates such as grains, 20% from protein such as meat. Second, we exercise, walking for 1 hour covering 3 miles. Third, we sleep 8 hours and do some meditation daily. Fourth, we track our numbers, continue blood works done twice a year as a minimum. Fifth, we keep on doing activities listed in first, second, third, and fourth items above throughout the rest of our lives. Always we need to consult our primary care physician in the US and general practitioners in the South Asian countries. In addition, first we need to restrict our eating habits. Generally, we eat 3 meals, breakfast, lunch, and dinner. There shall be no snacks, eating or drinking, except drinking water between the meals. Let us finish our dinner by 6 p.m. Wait for 4 hours before going to bed. There shall be no snacks during those 4 hours. Sleep from 10 p.m. to next morning 6 a.m. No food until 8 a.m. Breakfast at 8 a.m. Making 12 to 14 hours of fast every day. It is important that when we fast, our body recalls stored fats and reconverts them into glucose and use them for energy. Second, let us try to keep our stomach empty while eating a meal. It should be between 10% and 15%. If we are unable to achieve our goal after following the practices mentioned above, we need to increase the fasting time to 18 hours with a 6 hours feeding window daily. We must stick to these practices for good. It is said that we have our circadian body clock. From 4 a.m. to 8 a.m. in the morning, body wakes up and ready for action. Then from 4 p.m. to 8 p.m. in the evening, it is ready for rest. So we need to align our activities such as exercise, work, food, sleep with our circadian clock. Remember, when we eat, insulin rises, and when we do not eat, insulin goes down. We do not want insulin to be present in our bloodstream unnecessarily. By changing our lifestyles, we can reduce our medical expenses and we can live a healthy, happy, working, and personal, including family life. Thanks for listening. Stay safe, stay well.